Top of the morning, everybody.
Especially to you, Sir Martin.
I am Clarissa Faith Tamonan.
And I'm Angela Jo Niday,
your student nurses on duty. So, why are we making this video again, Ange?
Silly! We're here to discuss briefly about acute respiratory failure with pneumonia.
Oh yeah, right. Okay, so let me start off with what is respiratory failure. Now, respiratory failure is impairment of the lungs' inability to maintain adequate oxygen and carbon dioxide homeostasis. Respiratory failure is classified as acute, chronic, or acute on chronic. ARF, or acute respiratory failure, is any rapid change in respiration resulting in hypoxemia, hypercarbia, or both. It occurs over hours to days, and the term acute respiratory failure connotes a sense of urgency. Now, what are the two types of acute and chronic respiratory failure? Ange?
The two types of acute and chronic respiratory failure are hypoxemic and hypercapnic. Both conditions can trigger serious complications, and the conditions often coexist. Hypoxemic respiratory failure means that the patient does not have enough oxygen in the blood, but the levels of carbon dioxide are close to normal. On the other hand, hypercapnic respiratory failure means that there is too much carbon dioxide and near normal or not enough oxygen in the blood.
Now let's go to pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, causing cough with phlegm or pus, fever, chills, and difficulty in breathing.
Infections are a common cause of respiratory distress, and since pneumonia is an infection, it can cause respiratory failure.
Now, what are the signs and symptoms of acute respiratory failure?
Now, we must always remember that the symptoms of acute respiratory failure depend on its underlying cause and the levels of carbon dioxide and oxygen in the blood.
People with a high carbon dioxide level may experience rapid breathing and confusion.
And people with low oxygen levels may experience an inability to breathe, bluish discoloration of the skin, fingertips, or lips. You may also call this cyanosis.
People with acute failure of lungs and low oxygen levels may experience restlessness, anxiety, sleepiness, loss of consciousness, rapid and shallow breathing, racing heart, irregular heartbeats or arrhythmias, and profuse sweating.
Now let's move on to pneumonia's risk factors. You're more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease (COPD), or heart disease. Another is smoking, because this damages your body's natural defenses against the bacteria and viruses that cause pneumonia. Another is weakened or suppressed immune system, because with the absence of the immune system, acquiring pneumonia is easy.
For the acute respiratory failure, your risk factors are obstruction, injury, acute respiratory distress syndrome, drug or alcohol abuse, chemical inhalation, stroke, and infection.
For the pathophysiology of pneumonia, any infectious organisms that reach the alveoli are likely to be highly virulent, as they have already evaded the host's physical defense mechanisms. Consequently, they may overwhelm the macrophages, resulting in production of a fibrin-rich exudate that fills the infected and neighboring alveolar spaces, causing them to stick together, rendering them airless. The inflammatory response also results in a proliferation of neutrophils. This can damage the lung tissue, leading to fibrosis and pulmonary edema, which also impairs lung expansion.
The inflammatory response can also lead to the development of a pleural effusion, which is thought to complicate up to 40% of cases of pneumonia. These changes result in reduced gaseous exchange. As a result, vital organs become oxygen deprived and the respiratory effort required with each breath will be increased as a result of the disturbance in normal physiology. Respiratory and heart rate will increase in response to falling oxygen and rising carbon dioxide levels, which will then possibly lead to acute respiratory failure.
Respiratory failure can arise from an abnormality in any of the components of the respiratory system, including the airways, alveoli, central nervous system, peripheral nervous system, respiratory muscles, and chest wall. Patients will have hypoperfusion secondary to cardiogenic, hypovolemic, or septic shock often present with respiratory failure.
Ventilatory capacity is the maximal spontaneous ventilation that can be maintained without development of respiratory muscle fatigue. Respiratory failure may result from either a reduction in ventilatory capacity or an increase in ventilatory demand, or both. Ventilatory capacity can be decreased by a disease process involving any of the functional components of the respiratory system, and its controller and its demand is augmented by an increase in minute ventilation and or an increase in the work of breathing.
For the diagnosis of pneumonia, the doctor may recommend blood tests to confirm an infection and to try to identify the type of organism causing the infection. Chest X-ray to help the doctor diagnose pneumonia and determine the extent and location of the infection. However, it can't tell the doctor what kind of germ is causing the pneumonia. Pulse oximetry to measure the oxygen level in the blood. And lastly, sputum test where a sample of fluid from the lungs, sputum, is taken after a deep cough and analyzed to help pinpoint the cause of infection.
Your doctor might order additional tests if you're older than age 65, are in the hospital, or have serious symptoms or health conditions. These may include CT scan if your pneumonia isn't clearing as quickly as expected, and pleural fluid culture where a fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection. Treatment for pneumonia involves curing the infection and preventing complications. Specific treatments depend on the type and severity of your pneumonia, your age, and your overall health. The options include antibiotics because these medications are used to treat bacterial pneumonia. It may take time to identify the type of bacteria causing your pneumonia and to choose the best antibiotic to treat it. If your symptoms don't improve, your doctor may recommend a different antibiotic. Next is cough medicine. This medicine may be used to calm your cough so that you can rest. Because coughing helps loosen and move fluid from your lungs, it's a good idea not to eliminate your cough completely. And lastly, fever reducers or pain relievers. You may take these as needed for fever and discomfort. These include drugs such as aspirin, ibuprofen, and acetaminophen.
For the diagnosis of acute respiratory failure, it is based on the physical exam, chest X-ray, and oxygen levels. It's also important to rule out other diseases and conditions. For the imaging, you may be advised for chest X-ray. This can reveal which part of your lungs and how much of the lungs have fluid in them and whether your heart is enlarged. Next is computerized tomography or the CT scan, which combines X-ray images taken from many different directions into cross-sectional views of internal organs. CT scans can provide detailed information about the structures within the heart and lungs. For lab tests, A test using blood from an artery in your wrist can measure your oxygen level. If your doctor suspects that you have a lung infection, secretions from your airway may be tested to determine the cause of infection. You may also need heart tests because the signs and symptoms of acute respiratory failure are similar to those certain heart problems. Your doctor may recommend heart tests such as an electrocardiogram and echocardiogram.
For the treatment of ARF, the first goal is to improve the levels of oxygen in your blood. Without oxygen, your organs can't function properly. To get more oxygen into your bloodstream, your doctor will likely use supplemental oxygen and mechanical ventilation. Your doctor may also use fluids, but this is carefully managed because it is crucial. Too much fluid can increase fluid buildup in the lungs. Too little fluid can put a strain on your heart and other organs and lead to shock. For the medications, people with ARF usually are given medication to prevent and treat infections, relieve pain and discomfort, prevent blood clots in the legs and lungs, minimize gastric reflux, and sedate.
Wow, that was a mouthful of facts, right, partner?
Hell yeah, it felt like a tongue twister to me. Regardless of it being lengthy, I hope our viewers have learned a lot from us.
I think they did. I think that all of our viewers are all a potentially competent RNs in the near future. Let's all claim it.
Okay, so much for a lengthy ending. Thank you guys so much for watching, and to our dearest clinical instructor, thank you for giving us the opportunity to educate people about acute respiratory failure with pneumonia. And this is Clarissa Faith Tamonan signing off.
This is Angela Jo Niday signing off.